In this video, I will teach you the matrix in matrix technique for restorations with a really deep outline. Whether you're doing direct restorations or indirect restorations, deep outlines are really difficult to restore. In these situations, we often have two treatment options. One would be to do a clinical crown lengthening, in which we remove a little bit of bone and adjust the gum line to expose more of the root. The other option would be a deep margin elevation. A deep margin elevation means that we use a little bit of composite material to raise the margin to a more favorable height, usually at the gum level or maybe slightly above, which will make impression taking, isolation, and cementation of your indirect restoration a lot easier. In this video, I'm going to show you the matrix in matrix technique to do a deep margin elevation for an indirect restoration. In this case, I use the Supermud Adapt Supercap Matrix by Kerr. This is a circumferential matrix band, which is ideal for the matrix in matrix technique. However, sometimes when you want to apply this matrix band, it's a little bit too narrow to place around the tooth. So I use the tensioning instrument to make it a little bit wider so it's easier to place around the tooth. With this matrix band, we're not aiming for the perfect seal. This is merely a guide for our partial matrix band, which we will use in the second stage. So as you can see in the video, we still have some gaps on the mesial and distal side of this tooth. We can use our tweezers to change the position of our matrix band a little bit and push it a bit more in between the rubber dam and the tooth. We still see a slight gap on the mesial and distal, but that's okay, because in this stage we're going to apply our partial matrix band. This matrix band will be placed in between the tooth and the circumferential matrix. I really like to use my tweezers and a perio probe to get a good adaptation. I use my perio probe to push the matrix band a little bit away from the outline and away from the tooth, and with my tweezers I push down to slide it in between the matrix band and the tooth to get a good seal. If you want to, you can tighten the circumferential matrix band, but if you already have a good seal of your partial matrix band, it's not really needed. If you want to get an even better seal, you can often use a little bit of PTFE tape to push in between your matrix band and your circumferential matrix, and thereby putting a bit more pressure on the partial matrix band in certain locations. So in this case, I'm going to place a small piece of PTFE tape on the distal palatal part and on the distal buccal part to see whether I can get a better cervical adaptation. To use or to apply PTFE tape, it's always recommended to use two instruments, one to keep it in place, the other one to push it down. Now the matrix band is in place and we can continue with the restorative phase. In this case I use the OptiBond Extra Universal, which consists of two bottles, a primer and an adhesive. To use the primer, we do a small drop onto a microbrush and then apply it onto the preparation for 20 seconds, actively rubbing it in. We then air dry for around 5 seconds and then we can continue with the bonding. We apply a small drop of bonding onto a microbrush and rub it onto the tooth for around 15 seconds. We then air dry for around 5 seconds and then we light cure for about 10 seconds. In the next step, we apply a thin layer of flowable. In this case, I use the SimpliShade Bulk Fill Flow. I won't use it in the bulk fill method. I will just apply a thin layer of the material onto the tooth to cover all of the exposed dentin, which is also called immediate dentin sealing. This material is thixotropic, which means that it's quite stiff if it's just in place, but once you start to move it around, it becomes more flowable. In the next step, I will apply a little bit of composite to raise the margin a bit more. In this case, I use the SimpliShade Universal Composite and I go for a medium MD color, which is more like dentin. I use my LM Arte Condensa to move the composite around, and then I use a microbrush to get an even smoother surface. By gently tapping with your microbrush, you can create a super smooth surface. and I like to level this out to the center part of the tooth so I get an even surface from mesial all the way to distal. On the distal side I used a little bit too much composite, but you can easily remove the excess with your instrument. I again use the LM Arte Condensa to condense the composite, and then I use a micro brush to make sure I get a super smooth surface. You also see me using the LM Arte Fissura to remove a little bit of excess that went over my partial matrix band. The entire deep margin elevation is now completed and we can start removing the matrix band and check our result. What we often see is that we get a small ledge where the composite was pushed against the matrix band. And we want to make sure that this surface is super flat, because this will be the transition between the tooth and the ceramic. So I use a diamond burr from the Karma Margins burr kit. And with this burr we clean up all the margins. And we can then use a diamond strip, which is coated on one side, to clean up the transition between the composite and the tooth to make it as smooth as possible. And with a floss we double check our margins to make sure it doesn't fray or get stuck somewhere onto the restoration. If we take out this tooth and compare it to the initial tooth, we can see that we raised the margin with around 2 millimeters. You can also see that the cervical part of the composite, which we haven't touched with any type of burr or sanding strip, is still super smooth. When I go along the outline with my probe, we don't feel any ledges at all, and we can see that it's super smooth. The parts that we did touch with our burr and our sanding strip are a little bit rough, as you can see. And here you can see with the reflection of the light, the smoothness of the transition between the tooth and the composite. And that's what we ideally want for our gums. And this is how you restore a deep margin elevation case with a matrix in matrix technique.